Okay, so we're going to read last sentence. So which of the following conditions can be associated with this patient's diagnosis? Okay, so then I'm going to skim the answer choices. Okay, I mean, we know we're in endocrine, but nothing like the last one that tells me, oh, we're looking at MIN1, so we're going to have to read the question a little bit. So a 37-year-old woman with a history of hypothyroidism and recent significant weight gain presents to the clinic for a follow-up visit. She has been experiencing headaches and visual disturbances for the past month. Physical examination is unremarkable. Lab tests reveal low serum levels of TSH, LH, and FSH. A pituitary MRI demonstrates the presence of CSF fluid within the cella turcica, compressing the pituitary gland. So which of the following conditions can be associated with this patient's diagnosis? Okay, so what stands out to me, so I kind of like, I don't know if this is correct or not, but sometimes I just summarize in my head. I'm kind of like, okay, hypothyroidism, so weight gain, headaches, visual disturbances. So that's making me think of some kind of like pituitary adenoma maybe, but then you get to low serums of TSH, LH, and FSH. So that makes me think something's inhibiting GnRH. And usually prolactin does that, or prolactinoma. But then we have CSF in the cella turcica compressing that. So, okay, looking at our choices, I don't think it's Cushing's disease because, you know, it's not anything with ACTH, anything like that. Intracranial hypertension, idiopathic, that's just kind of when you have a headache from some unknown. So I don't think so. I'm not going to rule it out completely just in case it's just whatever, but not too confident with that one. MIN1, no. We kind of just went over those definitions. Polycystic ovary syndrome. That's usually with like hirsutism, and she has like a lot of androgen. Oh, wait. Yeah, so I don't think it's that. Sheehan syndrome is usually when she's pregnant. Is she pregnant? She's not pregnant, but it is Sheehan syndrome is whenever you infarction of the pituitary gland.
Okay.
So, well, it doesn't mention she's pregnant. Usually that happens with that. So I guess I would go with Sheehan syndrome. CSF. Is it Sheehan syndrome? So I think Sheehan syndrome, because I know specifically that has to do something with like infarction of the pituitary gland, but it doesn't mention that she's pregnant. So I'm like, that only happens in pregnant women. But then when you look at intracranial hypertension, and now I'm kind of stuck.
Okay, so let's talk those together. Okay, you're between two answers, right?
Yeah.
So I'm going to work it through. I'm going to talk to you kind of what I'm thinking, and then let's see if you can get to the right answer, right? So what's associated with this patient's diagnosis? So obviously, right, you got to figure out the diagnosis, right? So 37-year-old woman, hypothyroidism, recent significant weight gain, and presents to clinic for a follow-up. So when I'm seeing that, you have a young woman that has, hypothyroidism and is very big, right? So you got to be thinking obese patient. She has been experiencing headaches and visual disturbances for the past month. So she has a lot of headaches, right? Visual disturbances, maybe some migraine kind of ordeal, right? So in my mind, I'm like, maybe she has migraines. Physical exam is unremarkable, right? You don't see anything weird. You do a lab test, okay? Her TSH, her LH, her FSH, all that is low. Okay, that's kind of weird, right? So in my mind, I was like, okay, those hormones come from what? Okay, well, okay, then they do a pituitary MRI. It shows presence of CSF within the cella turcica compressing the pituitary gland. So you know that there's some kind of inhibition or structural damage to the pituitary gland because they tell you that, right? They said there's pressure compressing the gland, right, with CSF. So now, right, which of the following conditions can be associated with what's going on with this patient clinically? So which one do you want to go with?
Well, if she's bigger, does that imply she's pregnant? Weight gain?
No, not necessarily, because weight gain just is weight gain. Okay, so
Yeah.
think of it like this, right? So, do you know what another name for idiopathic intracranial hypertension is by any chance?
Um, pseudotumor cerebri.
Yeah, pseudotumor cerebri, right? And so, what are the symptoms that go with idiopathic intracranial hypertension? If you were to break it down with using that, what is the pathomechanism of idiopathic intracranial hypertension? If that makes sense. If you were to guess what symptoms you get with that, what would you get? If you have too much pressure in your brain, right?
Probably headaches.
Okay, good, right? And then it's called idiopathic because they don't know what causes it, right? But intracranial hypertension is caused by usually an overproduction of CSF, causing too much pressure in the brain, causing headaches, right? Sometimes migraines, right? And if you have enough of it, right, that can compress the pituitary gland. And if you compress the pituitary gland, excuse me, it won't work as well anymore, right?
Okay.
Does
Yeah.
that make sense?
Mm-hmm.
But if you said Sheehan syndrome, right? So this is the thing I'm trying to get you to understand. You said everything that you want to know about Sheehan syndrome. You said articulated super, super well, right? You said, she's not pregnant, it's usually an infarct, it usually causes this, right? But if you notice, you started to try to find things to support your answer, even though it doesn't exist in the question, right? You're like, oh, does weight gain mean she's pregnant? No. She's pregnant if she's pregnant. You know what I'm trying to say?
Yeah. Right.
Right?
So,
So the thing that I'm trying to get you to understand is that when you're doing questions, I want you to only make minimum 2 jumps in logic. Okay, what does that mean? So if the question's here, you have to say, oh, okay, so she has headaches. If headaches causes this, and then she must have this, right? But if you pick Sheehan syndrome, she's like, oh, she has, weight gain. If she has weight gain, then she might be pregnant. If she might be pregnant, then it could be Sheehan's, because if it's Sheehan's, then she could have this, right? So you're jumping so far in logic, right? So I want you to pick an answer that's almost directly related to the question. If so, then you're more likely to get it right. I always say if you think you're outsmarting the test, then you're probably incorrect on your answer choice.
okay. Gotcha.
Okay, does that
Yeah.
make sense?
Yeah, that makes sense. So, um, the reasons why it's idiopathic intracranial hypertension, just because of, like we said, her symptoms, but does the low TSH and LH, FSH, how does that contribute to idiopathic intracranial hypertension? Because I
Yeah.
was thinking like GnRH. Go ahead, sorry.
Yeah, no. I was saying that's a great question. So if you think about it like this, right? Okay, I'm sorry for my drawing once again. Hopefully you'll remember it for your life. Here's your brain. Okay, your brain has a little stalk, right? That's your pituitary, right? And your brain is surrounded by CSF, correct?
Mm-hmm.
Okay, so imagine this, right? Imagine that you have so much pressure, right? And obviously your skull surrounds that, so you can't compress out. So the only way you can is compress in, right?
Mm-hmm.
Okay, and so imagine all this pressure is kind of causing compressive symptoms, right, onto the pituitary, meaning you're kind of like you're kind of strangulating it, right? If you're strangulating the pituitary, do you think it's going to work correctly?
Mm-mm.
No, right? If the pituitary is not working, then it's not going to be able to create your, all your LH, FSH, SSH, all that stuff, right? All those hormones are not being produced because the compression is destroying your pituitary. Does that make sense?
Yes, yes, that makes
Okay.
sense.
And also on top of that, just so you remember, a little bit of risk factor for idiopathic intracranial hypertension is usually in younger females. Okay. Also on top of that, it's usually females that are obese. So you can
Okay,
kind of remember that too.
gotcha. Okay.